Dear friends, discharge from the anus is one of the really nagging problems and very important symptom a patient should be aware of, people should be aware of. What is discharge? Discharge is a liquid thing apart from motion when it comes, either with motion or mixed with motion or separately from the anal canal. If a liquid thing is coming out, we call it as a discharge. So, all the discharges are almost abnormal. We should get only stools from the anal canal. When we pass stools, a semi-solid sort of stool should come out. That is the normal consistency of the motion. Either it can be very liquid, and there are different varieties of discharge. In that, we normally describe discharge in four. This one. One is called mucus discharge. The other one is called serous discharge. Third one is called purulent discharge. Fourth one is called bloody discharge. So I will explain one by one. Mucus. Mucus is like what you get from the nose and all that when it leaks. So you have that. That is called a mucus. It is like a jelly-like material which is normally present inside the rectum and intestines. Inside the intestines and rectum, mucus is always present. But when it increases, then it will start coming out when somebody passes motion. If there is irritation in the rectum or in the intestines, then it will produce more mucus. So like when you get cold, you get more of mucus and serous discharge from the nose. Similarly here also. So when it is more, when it comes out, it is abnormal. There should be some reason for it. Or if the sphincters are not strong enough to hold it, so the mucus in the rectum can come out. So especially when you have done surgeries in the anal canal, post-operatively for some days, many of them will be getting a little mucus discharge, both because of the irritation and because the sphincters are not tight enough. So one need not worry about it, but that has to be studied. So one is mucus discharge is that sort of jelly-like discharge, and that has got its own significance and it has to be studied. It is not normal, and we have to investigate it and know the cause of it and treat the cause. You can't treat the mucus itself. You have to treat the cause, then the mucus will stop. Second is called serous discharge. Serous is nothing but watery discharge. That is because inside this one, intestines and rectum, there will be glands which will produce some sort of watery thing also called serous. So that also is abnormal. So if serous discharge looks like more watery. Third one is called purulent discharge. Purulent means pus. So pus coming out from the motion. How a pus looks, many of the people will be knowing. It is a little thick, milky like this one. Either it will be a little yellowish, greenish or whitish in color, and it will little thicker than the water and not thinner than the mucus. So and many times it may be having a foul smell also. So that is pus coming out. Pus coming out is very, very significant. It should not be ignored at all. And as early as possible, you have to go and get it checked and then get the proper treatment done. The mucus discharge sometimes can be from cancers also. One must be very, very careful. So get it examined. Then bloody discharge, where the blood is coming out along with the motion or separately blood is coming out. So this is all called bloody discharge. It's not simply blood. Most of the times it will be bleeding from the inside the rectum or in the large intestine. So altered blood will be coming. Means the color will be different. It will not be bright red. It will be a little violetish or darkish. So and the consistency also will not be like, sometimes it will be like clot and sometimes it will be mixed with mucus. So that sort of reason is very, very sinister. You have to get it checked as early as possible. Not only in the anal canal and rectum, we have to check in the sigmoid colon, whole of the large intestine called colonoscopy, and to exclude any other diseases like there are certain diseases like ulcerative colitis. that can cause bloody and mucous discharge. There are cancers in the rectum and the large intestine. They can cause similar discharges. And many other diseases also can cause this sort of bloody and mucous discharge. So any discharge is abnormal. Please get it checked by a proper person, a medical gastroenterologist or a surgical gastroenterologist, or at least a general surgeon, to know the cause of it and get it treated properly.